Okay, let's get started. So in today's session, the topics that we'll be covering are clinical settings and an overview of a patient encounter, some of the reports available in Zedmed Clinical, the scanning module, and we'll be closing out our session with clinical templates. First off, some housekeeping items to get out of the way. I can see the attendees today have already muted their microphone with the little microphone icon just to the left of the control panel. I just also want to point out that there is a button above the microphone with an arrow pointing towards the right. This can be useful if the control panel is hiding any of the presentation. Feel free to click on that and it will hide the control panel to the right-hand side of your window. Also, please feel free to type out any questions that you might have as we go along. Today's session, there isn't a large number of attendees, so please feel free to type in those questions and we will address them at the end of our session. All right, let's get started. So our first topic, as I mentioned, is clinical settings or my options that are available for doctors. You'll find that under the tools menu and my options. The my options window is broken down into 4 sections. As we can see along the top, we have general, drug options, document handling, and function selections. Let's look at some of the common settings that are generally input under the general tab. So the first setting is the show pathology paper request prompt. I'm going to turn that back on. What that setting is for, when ordering your pathology tests, there is a paper type that's required, that's not the blank paper, and that prompt can be a nuisance for some doctors, or conversely, can be a friendly reminder. So use that setting to your advantage. The problem search type. This is a good one to have set as predictive search. And the benefit of predictive search is as you're searching for a problem, it will actually search as you're typing. So it's going to search both the ICPC and the common lists. We will be looking at that in further detail a little later on in our session. The show encounter button captions. I do believe by default that this is unchecked. With this checked, what it will do is, as you can see from our clinical toolbar, it has the names of what each of the icons are underneath it. This can be beneficial having it turned on, especially if you're still getting used to the Zedmed system. It's nice to have those names under there. The font size. Zedmed will come with a preset of size 8. I know my eyes aren't getting any better as I age, so I would recommend putting in a font size of maybe 10 or 12, just to make it a bit easier on your eyes. The show consultations in history view. I'd recommend setting it to the last 10, especially for those patients that have been attending the clinic for a number of years. Their patient record might be quite data heavy and be a bit taxing on your workstation when you're calling up that patient record. So rather than displaying the full history, what this will do is only show you the last 10 consults, just to make it a bit quicker on that load time. The document template. I've set mine to the default referral letter template at the clinic. We will be looking at this in further detail as well. in today's session. And lastly, under general, preferred laboratories. This is where you can set your preferred laboratories for your pathology and radiology tests. This will link in with the referrals module. So that's the general tab. Moving on to drug options. Tell me when recalculating drug dates upon deletion of a script. If this is ticked, a pop-up is displayed warning the doctor when they delete a script from today's scripts. The date the medication lasts until will be recalculated based on the previous script. Another good one is remind me to renew prescriptions. Kind of obvious what that means. Allows doctors to override the global setting at the clinic as to whether a pop-up is displayed when there is a script requiring renewal. So if the global setting at the clinic is not to prompt you, individual doctors can set that as a reminder for prescription renewals. Always default to the PBS max repeats. When a drug is selected for prescription, the maximum number of repeats allowed by the PBS defaults into the repeats field. If this is not ticked, however, the default number will be 0. So that's a good one to have as well. And over to the right-hand side, we have the drug interactions automatic check. Again, I'd recommend having this turned on. If it's applicable and there are any drug interaction warnings, a warning pop-up window will appear when you are prescribing. If this is not enabled, there will be a button available in the script system window for you to do the check for interactions. However, if it's not clicked, there's no means of checking that. So keep that in mind. Generally speaking, I found that this is usually turned on. So that's the drug options tab. Onto the next tab is the document handling. The show distribution dialog. This will show the distribution window when you click on the distribution icon. If this is unticked, it will automatically apply the default distribution settings. Immediately underneath is show success messages. This will show you what has been sent and printed as a result of applying the distribution function. The distribute now settings. This allows you to select whether or not to send electronic copies to all electronic recipients, as well as how many copies of the letters and envelopes that are printed. And lastly, our last tab is the function selections. This is a really good one for the doctors where they can really customize Zedmed to how they like it to be. So you don't have to see all of the icons. We can't see them at the moment. We will see the encounter toolbar in a moment. But this can be a good one for specialists in particular, where a lot of the icons are kind of centered around GP user. This is where you could turn off a lot of the icons that you're not going to be using day to day, and to make the clinical window just a bit easier on the eyes. For today's session, however, I've only removed the add problem button and the delete problem button, because those two icons, there is another way of performing those two functions. For the sake of today's webinar, I'm going to leave all of the other icons remain turned on. So that's my options or the clinical settings that doctors can input. Moving on to our next topic is an overview of a typical patient encounter. Given the time restrictions of today's webinar, it will be a very light overview. I'll only be going through a couple of the typical functions that you'll generally perform with every patient. We will in future be releasing a more in-depth clinical video, which will be end-to-end. So to begin with, I'm going to start with the waiting room. Now, the waiting room can be a really great way of starting your workflow for seeing your patients. It can be the first step that you would perform. And what you would do looking at this screen is have a look at who your next patient would be. In this case, it's Eric Banner. And what you'd be doing in theory is walking out to the waiting room and calling Eric's name and bringing him back into your room. Once you do have your patient in your room, what we're about to do is create an admit timestamp here. So in the essence of communication throughout the clinic and safety, you can see that there's two other timestamps there. First of all, we have the appointment time, when the patient's booked in for. Column next to that is the attend time, when the patients actually walk through the doors and greeted reception, and reception have attended them into the waiting room. The benefit for you, the doctor, you can see in your own specific waiting room which of your patients are indeed waiting to see you. So by selecting your patient and clicking on the admit button, we'll then create this timestamp on the admit column, so that if any of the other staff members are keeping an eye on that particular patient, they will in turn see that admit time and have a mental check that, great, Mr. Banner is indeed in Dr. Seinfeld's consulting room. Let's go ahead and admit my patient. First thing we'll see is some pop-up warnings. So it looks like we have a front of office warning, which we'll take a look at in a moment. We also have prescription warnings. And it looks like we also have a pending result for Mr. Banner. Great, so I'm just going to pause for a moment. A few things have happened now that we've admitted Mr. Banner into my consulting room. The first thing I want to point out is our encounter timer has automatically begun. So there are several benefits to admitting your patient through the waiting room, is it's kind of starting the workflow for you. It's got our encounter timer begun, which coincides with billing, as we all know. You can see on the right-hand side, we have our encounter controls, and the start encounter has become inactive because it's already begun for us. Just while I'm here, I'll point out that we do have a pause and our end encounter buttons there. Just to step away for a moment from our patient encounter, just wanted to discuss the difference between the open patient button on the far left-hand side of the toolbar there. The open patient button can be a great way to find or review a patient's history. Just going to close these pop-up warnings here. So we can see the difference. I'm only looking at the patient's history here. The encounter hasn't begun. I don't see a timer up the top. I could see my start encounter icon is active, suggesting that if I wanted to, I could start an encounter. So the benefit of this is I'm simply looking into their history. I can have a quick read. All the information that I need is there. If I need to, there are some shortcuts under summary views, which I'm about to touch on. So just to summarize, the waiting room is a perfect way to start your encounter workflow with the patients that you're about to see. And the open patient button might be handy if you're picking up patients from another doctor and you need to see and have a quick read about what their history is, if they're on any other current meds, or what their current problems might be, just to get you in the right mindset of what's happening with that patient. While I'm here, I will point out that you can see my 2 patient tabs are up the top left here, and I can flick between the 2. It is recommended not to kind of queue up too many patient records there. I'd hate for you to enter in notes into the wrong patient file. I'm finished with having a read on Kylie's patient history there, so I'm just going to click on that little red X to the right of her name. And we're back to Mr. Banner's record. Before we deep dive any further, just want to give you an overview of the clinical window that we are looking at. So I'll start from the top and work my way down. So right up the top left-hand area, we have the clinical menu bar. Immediately underneath the menu bar, we have the clinical toolbar. The second toolbar that we now have is the encounter toolbar. This will only appear when you're in an encounter with a patient, as we saw looking at Kylie's record earlier. To the left of our screen, we have the patient details or the patient demographics window. I'll point out the tools icon in the bottom right corner. This is the patient details maintenance. And if we can just spend a bit of time in patient details, just want to discuss a few things here. So the first 2 tabs, patient details and next of kin and emergency contacts, these will generally be managed by your reception staff. What the reception staff can't see is in the bottom right-hand area is we have a clinical section here, which is only visible to the doctors. If I had a female patient, I would also see a pregnant checkbox, and I would also see a breastfeeding checkbox. So as your patient, you might be walking back into your room and you can see, oh, I can see my patient's pregnant. This can be a quick way of marking them as pregnant. Or vice versa, you might have an AFL footballer walk into your clinic. I would suggest ticking the elite sports person checkbox there. As I was saying, reception can only see the first 2 tabs there. Let's have a look at family history and social history. You can see some of it has been filled out. Indeed, Eric Banner is an actor. When this was filled out, he was single. I think he is still single. Sexuality. And turns out I do have some updates from Mr. Banner that he has a history of deafness, which might coincide with his social history, as he likes loud concerts. And the past history, Eric mentioned he's been traveling a bit and had some issues with tinnitus. But if your patient is unaware or just doesn't know, even putting in an NA will suffice. I know that with accreditation in mind, that your accreditors will want some input into these last 4 tabs here. So just to summarize, even an NA or a nil will suffice for accreditation. Pushing forward onto smoking, Eric Banner is definitely a non-smoker. The alcohol consumption, if this entire form is filled out, it will generate a score from the World Health Organization. But I know that time in your consults can be quite precious. So it is recommended that even the first 3 sections here, if that's filled out, is probably a good idea to put that in. And our last tab there, other clinicians. This could be used in a few different ways. So in a GP context, the GP field there, you could use if the patient is in the care of another GP, potentially interstate. If your patient kind of lives between 2 states, you can put your GP or second GP in there. And the other clinicians, you could potentially put in any specialists that the patient is in the care of. The other way that this could be looked at is in a specialist context, that GP field would be appropriate, is if you could put the patient's GP in there. And other clinicians, if they're in the care of other specialists again. This can be handy when ordering pathology and radiology tests to kind of have those doctors automatically appear in the CC fields or the copy to fields. Just saves you a little bit of manual entry when you're actually ordering those tests. Similarly with writing referrals as well. You can automatically have doctors copy to in there. So that's our patient details maintenance. Immediately underneath our patient details window, we have the summary views window. The summary views window has a lot of information and can be really beneficial for doctors to keep their progress notes up on screen and not have to kind of go in and out of windows. So the benefit is you can see I'm currently looking at the problems associated with Mr. Banner. There's no current problems, which is really good. I might want to quickly have a look and see if there's any results in the system, and it looks like he does have a pending result, or allergies. So kind of shortcuts to access other information while still typing out your notes. So really good. Summary views, quite handy. Underneath our summary views, we have the reference view, which is made up of 3 sections there. As you can see, the allergies, we've got a mango chutney allergy. The patient warnings, that was actually one of the pop-ups that appeared when we first started our encounter. Let's have a look at what that front of office warning was. I can see there's a lot of dots there, so it's wanting me to scroll down. Oh yeah, indeed, he's a famous actor. Oh dear, might turn into the Hulk. Okay, well, I'll get that back off screen. So a nice way to format any warnings that need to be communicated between your front of house staff and your doctors. Obviously, I'm having a bit of a laugh there, but you might see things like drug seeker, or they might be a little abusive at times. So that can be a great method for your receptionist just to quickly enter in. Edward, I agree, Edward Norton was the better Hulk. Thank you for that. But yes, it can be a great way just to communicate front of house warnings. And I know that's quite common through the different software packages there. Great. Also, while I'm there in reference view, you'll see any active recalls that are in the system as well. As we highlighted earlier, the little tools icon, you might see this appear in several places in Zedmed. quite similar to most computer software programs. Tools is indicating that there's more options or there's more settings that you can input there. With the allergies one, that's going to bring up the allergies window if I wanted to add any allergies into the system. And with the recalls, again, if I wanted to view the recalls window or add in a new recall as well there. Be mindful that there is a way to view any inactive recalls as well in the system. Excellent. So I'm going to spend a few minutes looking at the problems module, the drugs module, as well as what an RFE is. So let's get started. So we have the RFE. What this stands for is reason for encounter. And as I've just highlighted, it's why your patient's coming to see you. Why is the patient coming into the clinic? So as an example, I'm going to put in shortness of breath. And my notes might be like so. You might recall in my function selections in my options that I decided to turn off, add, and delete my problems. Why I chose to do that is you can see these two little icons here with the plus and minus is going to achieve that function for me. So I can add in more than one problem, which allows me to add in more than one reason. So my second reason might be medical certificate. And there's a bit of a debate whether why I'd have medical certificate as its own reason. Each to their own. I'm just a Zedmed trainer. I haven't been to medical school, and each has their own workflow. I'm just providing suggestions. Me as a simpleton, if I was reading through a patient's history that's been coming to the clinic for over 5 years, and I've got several consults, the history can become quite involved. Having RFEs is a great way of kind of breaking up your notes and kind of putting in subheadings, if you will. And as you can see, if you look below, RFEs will always appear in green. So it's a nice way of breaking up your notes. There's another reason why I've put in medical certificate, and I'll get into that in a moment. So I've got this third problem tab here. Turns out I don't need the third tab, so I'm going to go ahead and click on the delete encounter problem. So I'm left with my two reasons. I've got shortness of breath and my medical certificate. I'm going to go ahead now and define this problem by going into the problems icon. Defining a problem, what that essentially means in Zedmed is providing a diagnosis for the reason. So defining a problem is essentially providing a diagnosis for the reason for encounter. With Zedmed, we link into the ICPC database. And the ICPC database, what that stands for is an International Classification for Primary Care. And it's designed to be a user-friendly system for doctors and is beneficial, particularly if the problem interacts with drugs that you're prescribing. So defining problems, it does link in to the drugs module where it's appropriate. So defining problems has several benefits, as I've just mentioned. Another setting that I input, you might have picked up on, is it's defaulted to the predictive search. And the benefit of that is it's going to start searching the ICPC database as I'm typing. So through conversation with my patient, I've determined that his reason, the cause for his reason is asthma related. And as you saw, as I was typing out that word asthma, it's going to start searching and filter down or narrow down the list of options that I have available. Just as a side note, you do only need to type out the first 3 characters of what you're searching for, and it will start searching and filtering down that list. So I found my problem. I'm going to do a single click on my problem, and I'm going to click on the Select Problem button. And what that's done is you can see up the top that my problem tab is now defined with asthma. And I know this because it's appearing in red text. I no longer see the undefined problem text up the top there. So that's how we can go ahead and define a problem. And like I said, is essentially providing the diagnosis for the reason. Just want to point out down the bottom, we have the onset date field. If we have goals to upload to My Health Record will need an onset day, even if it's just specific to the year. If you can, make it more specific to the day or month, but be mindful when uploading to My Health Record, it will require an onset date. Now, I haven't spoken about what the common option is. The common option is a common list at the practice. So you can, as you're defining your problems, you might find that you've got a lot of asthma patients in that particular region where you're at, or it might be the time of year. You can add this to common. And in time, as you've added a whole bunch of problems to your common list, you might find that you'll only need to search the common problems list instead of both ICPC and common. So I just wanted to touch on that. It's kind of like a favorites list for your problems. Also, I've just had brainwave, and it might have been a question that's come through. Your first patient of the day. When searching ICPC, there will be a little bit of lag where you've typed out the word asthma and it's completely blank and kind of tapping your finger on the table thinking, what's going on? With your first patient, the first time you do a search in the ICPC, there will be a few seconds of lag that is just pulling that information down onto your computer. Be mindful, it's only the first patient. Every patient after that you see in the day will be nice and snappy, as you've seen it in our webinar on screen. Just while I'm here, I still have this undefined problem. With a medical certificate, there's no way of providing a diagnosis for a medical certificate, so you're not always going to be able to define a problem. It is suggested to try and have an RFE in your consultation. If there's no RFE or problem, Zedmed will pop up a warning when you're ending that encounter. Great. So that's the problems module. Just to point out, you can see our defined problem here, asthma, and our undefined just next to it. Diving into the drugs module now. Clicking on drugs will bring up the script system window, and it's broken down into 2 sections here. So we have existing drugs. Existing drugs can be a really great way of quickly re-prescribing. I can see I have 2 medications here that are ready for renewal. And I know that because they're appearing in red text, kind of telling me that it wants my attention. So to do a exact re-prescribe, it's nice and easy. I can do a quick double click here. And you can see down in my today's script window, it's put it in a print queue ready to be printed. For those of you that are really observant, you'll see that my amoxicillin is no longer appearing in red because I've just re-prescribed that. Before it was appearing in red to say that it's due for renewal. And if you recall, when I first started my encounter, that I had these prescription renewal warnings appearing as a pop-up message. Just while I'm here as well, I've just discussed with my patient that he's no longer taking Metamucil. Doing a right click will allow you to make medications as non-current. Just while I'm there, you can see that there is a re-prescribe option as well. What I've done by double clicking is the exact re-prescribe. This will allow you to do a re-prescribe if you didn't want to do the exact. I'm going to make that non-current, and you can see it's moved into the non-current medications section. Going over to the new drug, we are linked into the MIMS database. And I'm going to do a search for let me think. And I'm looking for an inhaler. So that's the instance that I want to prescribe. With it selected on screen, I'm going to click on the prescribe button in the middle, which will bring up the dosage calculator. There's a few ways of adding in your dosages. I'm going to use the dosage calculator up the top. And you can see in my text field that it's input my instructions. So that's the first method. The other method is free texting. And the last method is highlighting information from the drug, the MIMS reference information here. So I can highlight a section, right click, and say paste to dosage. So 3 methods of adding in a dosage. I'm going to stick with my dosage calculator. You do have your options for regular use, PRN, and short term. This, depending on what setting is input here, will affect the patient renewal pop-up warnings. Once you're happy with your dosage, you can click on prescribe, and that's going to throw it down into the scripts print queue. For those doctors that are prescribing compounded drugs, you will find the new recipe drug up the top right corner, which will allow you to create that specific recipe. Oops, just going to cancel that. So a very quick overview of the script system. At this point, what the doctor would normally be doing is clicking on the print scripts and close button. For today's session, I'm just going to click on the close button. So with time in mind, I know that's a very brief overview of a patient encounter, but most of the time you will be entering in an RFE, providing a diagnosis, and prescribing some medications. As I mentioned, the problems tab under summary views, you can see it's updated our current problems. and the medication as well that I've just prescribed for my patient. So that was our patient encounter overview. Moving forward onto our next topic, something that is quite overlooked in Zedmed Clinical, and it is hiding out in our menu bar at the top, and it's the reports. There is a lot of reporting functionality in Zedmed Office. However, there is some reports that we can run through the clinical side as well. There are quite a lot of reports, as you can see. If you would like some detailed information on some of these reports, please ring through to our support line and we can go through that with you. There are a few that I've picked out just to showcase today. First one I want to look at is outstanding referrals. I'm just going to read up the top here. This report shows details of open referrals for which no results have been received or instructions and actions have not been completed. Let's have a look. I'm just going to click on the screen. I'm happy with that date range. I'm going to take it back a year just so I can pull some data from my test system. Okay, great. So I'm just going to zoom in to make it a bit easier. So as you can see, I've only got 3 patients where there needs to be some action, where there's no, as we saw on the previous screen, open referrals which have no results or no instructions or actions. So in a perfect world, this would be completely empty and you're on top of your referrals and you're managing that quite well. I'm okay with just the 3. This is kind of highlighting that I've got 3 action items to look into. The next report that I'll showcase is the chronic disease module. I'm going to select the GP Management Plan 721 and click on Load Report. And you can see what's appeared on screen is it shows the patients with a chronic disease management plan in their system, or a 721. So a great way to see who's under a GP management plan at the clinic. You can see by the report selection that there are several reports that you can generate depending on the plan that you're looking for. The script report is also a good report. Let me just take my date range back. This time I'm going to choose a group by item. I'm going to say by doctor. And I'm happy with the rest of these settings. I'm going to click on screen. And again, we'll show you a script report for all scripts that have been written. Obviously, being a test system here, I haven't got a whole lot of data. Normally in the real world, I'd expect there'd be quite a few pages in this report. And the last report that I'll showcase, also a really good one, patients missing allergy info. Quite important data to input into a patient record. And again, this is a report that can highlight any action items for your doctors. So you can see I've got a total instance of 23 records that have no allergy information recorded. So I'd interpret this as this 23 patients that A, have no allergies and have never really been prescribed any medication. So in order to use the drugs module, you absolutely have to have allergy info recorded even if the no known allergies button is selected. So that's the missing allergy info report. Moving on to our next topic, and that is the scanning module, which is through the scan button in the clinical toolbar. So the scanning module is used to obviously scan in any documents, letters, or any images. And this will obviously link into a physical scanner at your workstation or at the clinic. What we'd normally be doing at this point is, depending on the type of scan that you want, you would start with the first 3 buttons in the top left-hand side there: black and white letter, color letter, or custom scan. Now, the first 2 are kind of explanatory, where it's a letter and whether you want black or white. The custom scan will allow you to really specify specific settings that you want to input for the scan that's about to take place. So things like the size, whether it's black and white or color, the quality, things like that. Once you do successfully scan into the system, you will see a preview on screen like we do now. I've got a knee x-ray here. There's 3 ways of viewing your results. Sometimes, like this particular one, it's quite large on the screen. And I know that I've just performed 2 scans, but I can only see 1. So up the top, we have image, thumbnails, and file list. And depending on the type of way you like to interact with the computer, you would either choose thumbnails or file list. Personally, I like the file list because you can see it a bit easier. And indeed, I can see the 2 scans that I've just performed. Now it's up to us to kind of link these scans with a patient. So I'm going to go over to my Find Patient search. I'm going to look up my patient's surname, click on Find, and select. Now there's a few ways that you can save your scans. They can either be saved as results or images. You can also link scans to referrals. So first, let's look at results. And I have my document here. I'm going to click on results button just here. I'm going to give it a description. Oops. I would input the document date and time. Let's just say a week ago, and who the treating doctor is. I do want to specify how I want to save this. So I'm going to say it is a result. And for the sake of our exercise today, I'm going to say that the doctor hasn't seen this and to not mark it as complete. So I've put in a description, the date and time, who the treating doctor is. Indeed, it is a result, and I don't want to mark it as complete. The doctor hasn't seen it. I'm going to go ahead and click OK. And you can see that's disappeared off the screen to suggest that I've successfully linked that into the patient, and I can see it appearing in green on the left-hand side under New. Now, because I have marked this as a result, what that means is this will also appear in your results inbox. So be mindful of that when you mark a scan as a result, that will then also appear in the results inbox for the doctor. The second method is as an image. Again, the date and time, and OK. And you can see that appears under images. If I wanted to link one of those images with one of the referrals that we can see on the left there, it would be as simple as dragging that image on top of the appropriate referral there, and it would be linked into that referral. So that's the scan module. Again, your starting point will be one of these three buttons. You can view your results in one of these three tabs up the top. You would find your patient and link it as a result or a general image. You can see there's my result there and my image. The last topic that I'll conclude our session with is templates. There will be a dedicated lunch and learn on templates and formatting. So again, just a quick overview for today. To look at templates in the system, you'll find them again under the Tools menu, Clinical WP Setup, and across to WP Templates. If you're wanting to create a brand new template, I would suggest starting with the blank, doing a right click, and go to Edit Template. As you can see, it is the blank template and brings up a word processor for you to create that template. To demonstrate a few functions, I'm going to edit the referral letter template in our system. The first function I want to talk about is the data toolbar on the right-hand side. If you don't see the data toolbar, you can press Control D on your keyboard, which will bring up or hide the data toolbar. You can also find it under the View menu, Data Toolbar. The data toolbar is a great way to perform the function of a merge field, which some users might be familiar with in Microsoft Word. What it's going to do is basically pull information from the clinical record. So as an example, I want to put in the current problems that the patient has. So I'm going to go into clinical details, and I can see there's a few instances here, but it's cut off. So I can actually stretch out this drawer here. And there's the one I'm looking for. I want the current problems list with comments. I'm going to make sure my cursor is where I want that data point to go into, and double click to insert. So you can see when I use this referral template, it's going to pull in all of the current problems with any comments. Just to demonstrate again, I'm also going to input the current medications. And you can see there that it's inserted that merge field. Just while I'm here, a common question we get through to our support team is how to edit or even input headers and footers. I know that most clinics want their letters to look professional and have your logo up the top and some contact details down the bottom. So a nice, easy way to do that, first of all, is I want to insert a header and footer field. So under View, I have Manage Header and Footer. I'm going to add in a header for all pages, as well as a footer for all pages. Now what I can do is click up the top into my header, and you could either free text the information In this particular case, I also want to demonstrate how to insert an image. So I'm going to locate a logo that I've prepared earlier, and I'm going to resize it with the control handles, and I want it on the right side of my page with the right justification button there. So I'm happy with that, and now I want to input a footer. So I'm going to do it the same way. I've got an image for my footer. I'm going to go into the insert menu, choose image, find my footer, and click open. Now I could tweak around with this and make it smaller and make it visually appealing so that it does stretch to the edge of the page, but just with time in mind, I won't play around with that. So that's how we can edit an existing template. Obviously, the most important step is to save. If you wanted to rename it or create a second instance, you could choose Save As. I'm happy to replace the referral letter that's in the system. I'm going to say Save. Yes, I want to replace it. And what I've done is I've just edited the referral template. Once you've made the changes to your template, it's also really important to make it available for everyone to use. So doing a right click here, there's two things you want to do is available to all users, as well as toggle as quick documents. The quick documents you can access on the left-hand side here, which is all the letters available in the system. If you're wanting to import a template, we have the file menu, which you can import templates through our website, as well as make your own in Microsoft Word. They do need to be in an RTF format. So that's clinical templates, a very quick overview. As I mentioned, we are going more in depth in a later session. So that's the content we'll be going through today. Just a couple of notices to end out our session. You will need to register for future Lunch and Learn webinars through our website. Please do, there's some exciting topics still to occur. They will be recorded and uploaded to our website. If you can't make them all, you can watch them at a later date at your convenience. We'd love to hear your feedback. If you have any, feel free to email us at implementation@zedmed.com.au. Some resources available to you is the Zedmed client login. You can register for access for how-to manuals and guides. We also have a very friendly support help desk team available through the week as well as after hours for emergencies. Thanks everyone for joining today's Lunch and Learn webinar on Introduction to Zedmed Clinical. We hope to see you again. Thanks very much.